current geopolitical concerns have kind of really have the potential to impact healthcare delivery, in particular in Guam and the Mariana Islands. The terms second island chain and the tip of the spear have been tossed around, and they're very much defense statements. And Recently, Admiral Paparo, commander of the U.S. Indo-Pacific Command, testified in front of Congress that said basically military conflict is probably going to come. In a separate testimony, retired Major General Paul Friedrichs actually mentioned that he felt that civilians and military should be working on strengthening trauma systems and critical care systems within your healthcare systems and throughout basically the northern Pacific. Although I also believe that American Samoa should be involved in that because you are no stranger to tsunamis and earthquakes and cyclones and whatnot. I wonder if each of you can kind of mention your concerns on this, how you're approaching this. Do you feel that your health systems are prepared for this? And let's start with American Samoa and then we'll go backwards.
With public health, I think that's one of the reason behind erupting this new facility. It's a two-story facility because the current facility right now, when it rains a lot, it floods all over around the building, and it's difficult for patients to come around to park and all that. So to erupt that second floor would probably be better for patient and clinics, and then use the bottom floor for other projects or other offices or whatnot that have nothing to do with patient care. Yeah, we do get attacked by cyclones on occasions. We had one tsunami in the past couple of years, which was a disaster for the island. Never experienced that. Fortunately, it wasn't as bad. I think it only killed 30 plus people out of our population of 55 at the moment. But yeah, heavy rains and hurricanes, cyclones attacks us every now and then. And then, of course, pandemic, just like the COVID that hit us and other outbreaks of diseases. So it can get worse. We never know, but we need to get prepared as far as facility-wise is concerned. The capacity of our current hospital, as well as our health, as well as our public health community clinics, is sure not enough at this point to handle any major disasters that would come in on island. So that is something that we definitely need to foresee and proactively work at for any worse events that could happen in the future.
Yep.
Thank you, Dr. Erica. Just to add on to that, I mean, being the only hospital on the island chain and also being in a tsunami zone, but also not to mention there's only one road on the island. So we're talking about infrastructure issues that could directly affect our ability to handle any surge. But I think the most important fact as is that we have contingencies and resiliency plans that are put in place for specific surges. However, what I'll say is that not knowing what the surge could be, I feel like it's more important because it's a real finite time that we can be able to handle that surge, and I feel like that's something that is not often evaluated because we build these structures and we have these surge plans, but the time is ticking, and how long are we able to operate at a surge level? And I feel like that's the biggest issue.
Yep.
Because I'm confident in, say, an event that occurs, and then you have, maybe another following period but then we also have emergency dispatchment. There's a lot of things that occur after that. But I feel like one of the biggest issues that we're focused on here in terms of our emergency management is extending that time frame of being self-reliant on the surge and making sure that the capacity that we have to handle the surge could be drawn out a lot longer than we thought. Because I feel like that if there is any conflict or if there is anything that's discussed when we're talking about medical emergencies in our region, we have to make sure that people realize how massive the Pacific Islands and the Pacific Ocean actually is, and how much ground there is to cover, or how much ocean there is to cover. But if help is to come from Hawaii, if help is to come from all of these places, we're talking about still hours out,
Mhm.
and priorities may not be for a remote island that is got a small portion of the population. And so I feel like our resilience and our surge plans have to include some type of plan for increasing that sustainability so that we can be able to handle these emergencies and these surges a little bit longer than the usual 48 to 72 hour acute surge plans that are usually in place.
Yeah. Esther, how about Mariana's? You might be muted.
Sorry about that. Yes,
No.
I think it's you know, it may be a little bit too late, but I think it's very important that there's a lot of training. I think there's a opportunity for training, training our resources here, our personnel, also resource sharing. There's right now we currently use DoD to transport patients to Guam, for example, but that's based on their availability. And so there's an opportunity to help us with our infrastructure, to manage large scale casualties. I mean, that is definitely something that we would love to see how that can basically go through our system. um, our system is I think it's well known in our jurisdictions that we don't have that strong infrastructure. We're talking about, there's actually a study conducted by DOI through the USACE, Army Corps of Engineers, that shows that our facilities are aging, and it would be good for the military to help with that. And again, going back to training and resource, sharing, logistics.
Great. And Lillian and Art, I mean, Guam is kind of heavily military. I think what 35%, 40% of the island is U.S. military. How do you feel? Even having the military hospital on the island as well as the private hospital, how do you feel you're prepared to deal with a surge in mass casualties if there is something?
Honestly, I don't feel that we are prepared. Our facility here is, as Esther pointed out, it is aged according to the U.S. Army Corps of Engineers when they did their assessment in 2019. We're not recognized or designated as a trauma center at any level, but because we are the only public hospital, we take any trauma that comes through, and so we do have limited capacity in our emergency room and in our trauma rooms in the emergency room, and so there is a lot of bus work going around within the military to prepare, and we've been having quite a bit of visits. In fact, we're being visited Thursday by the U.S. Navy Secretary coming here to tour our facility, and there have been several others who have come to take a look at our facility. But again, I'm just concerned that we just don't have the capacity. Yes, we can have the training, but the structure itself, we don't have it available. And the military is building up the military defense agency. They're building up their capacity too to defend, if there's any potential attack, because strategically, Guam is looked at as as a very strategic value to the military, to the U.S. And so we are a target that can happen anytime. But our facility, our resources, our workforce, we don't really have that capacity to respond to if there's any trauma or any kind of a mass casualty. We practice and we do drills to prepare for it, but we recognize our limitations and our challenges. So, Art, do you want to?
Sure, absolutely. To add on to Lillian's comment, I'll make this really quick and brief, but at the end of the day, really, we're looking into DoD for partnership. We're looking for DoD for partnership. As many of you may know, or some of you may have heard, the governor has been a true advocate to build a new hospital. Well, that's going to take years. The idea of military partnership could make that happen sooner than later. Recognizing there's a shared vision, there's a shared need, there's a shared plan in terms of what could happen should there be mass casualty. Now, another question that will come up is if we do expedite the construction of a new hospital, what will happen to the current hospital? Perhaps that's an opportunity for DoD to consider this hospital, this location, to retrofit it, to refurbish it, to strengthen it. It may not be as big, perhaps it may need to be resized, but what is operational, functional? There are existing capacities within the structure. It is an aging structure, and there is a high cost related to refurbishing and renovating the hospital. But if we're going to have a new hospital and we are looking at perhaps an alternate site for a trauma center, if not added on to the new hospital. And so really looking to DoD, I know the governor has had multiple meetings at different defense representatives and has expressed this request on multiple occasions. And she's, I believe, even gone public and have expressed that she is looking to the military and to our partners in the military to look at how they can assist us move this effort forward. The original plan for the hospital was not successful given some local situations that were had to be dealt with. But definitely in that right of it, it's very clear that there was a partnership already expressed that in the event there is a situation that the Department of Defense with the Guam government to ensure or to do their best to ensure that we address a mass casualty situation. Some food for thought perhaps that we could be advocates for.